SNAP, the Supplemental Nutrition Assistance Program. The first food assistance program was initiated to align growing food surpluses with a concern for the needs of the poor as the country emerged from the Great Depression. Though the program only operated in about half the counties across the nation, it served nearly 4 million people a month at its peak. In times of great agricultural surpluses, which usually are accompanied by great unemployment, it will be there to do a minimum job in terms of minimum diets below which the public health would be endangered. Milo Perkins, 1939. Objectives: to provide a brief history of the nation's most critical food assistance program. Introduce the policies that have created what we now know today as SNAP. Explain how the program supports recipients, where it is lacking, and how I believe it can improve. The base idea for what we now know as SNAP came as the government's best attempt to alleviate hunger in America. It was first introduced by the 11th Secretary of Agriculture, Henry Wallace, and the program's first director and economic professional during that time, Milo Perkins. The phrase food stamps comes from the very first food stamp program that was put into action during the closing of the Great Depression. It started out as a pilot program which allowed disadvantaged individuals, such as the poor and hungry, obtain food stamps for a fee. While the program aided families who were in need, the program itself was created following the Great Depression with an intention to provide agricultural farmers who had an excess of supply with means to sell their goods. SNAP is currently the leading nutrition assistance program in the U.S. It is overseen by the USDA and is designed to be the first line of the nation's defense against hunger, lack of nutrition, and anti-poverty initiative. SNAP plays a vital role in not just decreasing food insecurity, but also laying significant groundwork for low-income households' health and well-being. Unfortunately, SNAP has its limitations. While the SNAP program does improve food security, ample evidence suggests that the SNAP program does not specifically target the issue of food deserts. SNAP is organized, conducted, and implemented by the USDA. The federal government finances the full cost of the SNAP program. The cost of the operation and execution of the program is split amongst the state and the local governments, and sometimes the organizations that manage this program. States and counties are crucial components of the federal, state, and local partnership when it comes to the delivery of SNAP and other social programs. Because SNAP is deemed an entitlement program, it implies that an individual who qualifies under the program rules can receive benefits. Income limits for SNAP recipients differ from state to state. Federal mandate asserts that SNAP assistance is only eligible to individuals with gross incomes up to 130% of the federal poverty line. In 2020, pre-COVID, $1,354 a month, or $16,248 a year, was a household income limit for a single person. A family of two had to make less than $2,311 a month, or $27,732 a year to qualify for SNAP benefits. In the state of Kansas, SNAP eligibility and enrollment falls upon the Department of Children and Families, or DCF for short. Once income eligibility is determined, an EBT card will be mailed out with the benefits you qualify to receive. Policy evaluation. History has proven that SNAP does provide heads of households the opportunity to put food on the table and offers more nutritional funding and aid to impoverished youth and families than any other federal program in the United States. Statistics prove that SNAP aided and made sure that 20 million children had some form of nutrition every single day during 2019. SNAP provides the necessary foundation for the well-being and health of the nation's children, keeping millions of children and households from experiencing food insecurity and possibly starvation. Data proves that food insecure homes, insufficient access to nutritious food for an effective and healthy life falls by a third once a household receives their SNAP allowances for at least the following 6 months. And families with children also receive additional subsidies during the summer break when majority of children are not in school. An updated Thrifty Food Plan increases recipients' future SNAP benefits and allows them the means to purchase quality nutritious food for a couple of weeks. However, having access to quality nutritious food is another story due to food deserts. Research suggests that nutrition choices made by residents who occupy food deserts may be influenced by proximity to food sources, food prices, and travel expenses. For instance, research proves that more than 800,000 Kansas residents lack access to fresh, affordable food due to inadequate access to nearby grocery stores and supermarkets. In Wichita, convenience stores make up 40% of the city's food retailers. However, only 44% of those retailers offer fresh fruits and only 9% offer fresh vegetables. In conclusion, research from 2015 suggests that nutrition choices made by residents who occupy food deserts may be influenced by proximity to food sources, food prices, and travel expenses. Supermarkets and larger grocery stores tend to have the lowest food prices. Residents of communities without these types of venues more often have a challenging time affording nutritious food due to higher food costs from the smaller stores that are located within the community. After 7 decades of food assistance programs, differences remain between small store owner venues in urban and low-income communities and big chain grocery stores across the nation. Therefore, implementing networking principles in the agricultural food chain level may assist researchers and policymakers in creating system interventions at the producer and manufacturer levels to enhance the food environment in low-income areas. To that end, evidence proves that SNAP does help. Therefore, it should continue to be conducted. However, data also proves that access to quality, nutritious food is a problem for low-income communities. Therefore, eliminating food deserts is of utmost importance, and to a substantial extent is dependent upon the capability of state and local governments to attract investments and flow of capital to revitalize those low-income and urban neglected areas.